Welcome to this critical session on enhancing patient safety. As spinal cord injury or SCI staff, nurses, and nurse assistants, you are the frontline defense against preventable complications like pressure injuries. Our focus today is one of the most essential yet underemphasized interventions: turning patients every 2 hours. This simple action can mean the difference between healing and harm. With consistent practice, we uphold dignity, promote healing, and reduce hospital-acquired complications. Veterans with spinal cord injuries are uniquely vulnerable due to impaired mobility and sensation. They rely on us for vigilance, compassion, and excellence. My name is Michael J. Orellano, your SCI nurse educator. This session is not only about compliance, it's about caring deeply and acting proactively. Let's deepen our understanding, reinforce teamwork, and protect those who have served our nation with honor. Today's learning objectives set the stage for effective and safe SCI care. First, understanding the why behind turning schedules helps reinforce how we deliver care. This is not just a task, it is a safety measure rooted in clinical evidence. Second, identifying risk factors using tools like the Braden scale empowers the team to act early. Our veterans often cannot alert us to discomfort, so our role is to proactively protect them from harm. Lastly, we'll discuss how teamwork, clear documentation, and consistency across shifts are essential in maintaining best practices. Whether a staff nurse or assistant, everyone contributes to safety. Each objective builds a pathway to excellence. When these components align, veterans receive holistic and dignified care. Routine turning is foundational in SCI nursing care. Veterans who are unable to reposition themselves risk severe skin breakdown, infection, and pain. When pressure is not relieved, tissue ischemia can lead to stage 3 or 4 pressure injuries, conditions that are preventable with scheduled repositioning. Turning enhances patient comfort, minimizes pain, and supports respiratory and circulatory health. Beyond physical outcomes, it fosters trust. Veterans feel seen and safe knowing consistent care is provided. This action represents shared accountability. When every staff member follows the same protocol, safety becomes a team-wide standard. Compliance should never depend on shift or staffing level. It should be a culture. Let's make the 2-hour turning schedule non-negotiable because the stakes are too high to ignore. Assessment is the first step in pressure injury prevention. The Braden scale remains a trusted, evidence-based tool for assessing a patient's risk by evaluating factors like mobility, moisture, nutrition, and friction. A daily score guides proactive interventions. Patients are especially vulnerable at sites like the sacrum and heels. These must be inspected thoroughly during every shift. Watch for redness, heat, or bogginess, signs of early-stage pressure injury. But no one works in isolation. Nutrition affects healing, so dietary input matters. Physical therapist and occupational therapist enhances mobility and posture. Wound care brings clinical insight for ongoing prevention. Prevention is a shared responsibility, and our success hinges on communicate ion and collaboration. Early detection saves lives. Following turning protocols is a clinical priority. Veterans in bed must be turned at least every 2 hours. Those in wheelchairs should be assisted or cued to reposition every 15 to 30 minutes. These intervals are supported by extensive literature and national guidelines in NPIAP 2023. Use tools like slide sheets, wedges, and low air loss mattresses to protect both patient and staff during turns. The turning effort should not cause friction or shearing. Documentation is vital. Every turn should be logged with time, new position, and skin assessment. Not only does this promote continuity of care, but it is also a legal record that protects both patient and clinician. No step should be skipped. Consistency leads to safer outcomes and fewer avoidable injuries. Sometimes, despite best efforts, pressure injuries occur. The key is early recognition and prompt action. Use the NPIAP staging guidelines to correctly assess severity, from stage 1 redness to unstageable wounds. Accurate staging informs appropriate treatment. When wounds are identified, notify the wound care team without delay. Early intervention reduces complications like infection and prolonged hospitalization. Veterans and their families should also be part of this journey. Educate them on skin checks, dressing changes, and warning signs. Empowerment aids recovery and builds trust. Avoid blame. focus on solutions and healing. Communication, respect, and urgency define our response. Let's commit to healing, not just reacting. Pressure injuries are not benign. They are clinical emergencies. What begins as skin redness can quickly evolve into deep tissue destruction, sepsis, or bone infection. Advanced wounds increase the length of stay and treatment costs while diminishing quality of life. Veterans may feel overlooked or neglected, particularly if injury occurred during a preventable lapse. Once trust is lost, rebuilding it is difficult. As professionals, we must treat every skin concern as a potential crisis. Early action shows veterans they matter and their care is a top priority. Let's turn awareness into action and avoid these devastating outcomes through consistent prevention. Let's close with a call to action. Turning patients regularly may seem like a small task, but it has extraordinary impact. It prevents suffering, shortens hospital stays, and improves outcomes. Vigilance must be constant. Unity among staff, regardless of role, is critical to implementing care that protects our SCI veterans. These men and women have sacrificed greatly. They deserve not just good care but the best care. Consistent turning reflects our values, safety, dignity, and accountability. Let's embed these principles into our culture so every veteran leaves our care safer than they arrived. Thank you for being part of this essential mission. This presentation was developed using the most current, evidence-based literature on spinal cord injury-related hypotension. Each reference listed supports a key aspect of SCI nursing care, including pathophysiology, assessment, prevention strategies, and emergency management. These sources ensure the accuracy and credibility of the strategies presented today, aligning with best practices and promoting excellence in spinal cord injury rehabilitation and nursing leadership. Thank you for your time and unwavering dedication. What you do matters more than words can express. Every turn, every skin check, and every moment of advocacy helps prevent suffering and promotes healing. Your role is not simply to provide care, it is to protect lives, uplift dignity, and model excellence. SCI veterans face many barriers. Your vigilance removes one of the most dangerous ones, preventable harm. When we act as one team with a shared purpose, we become a force for healing. Please carry today's message into every shift and interaction. Let's continue to turn knowledge into care, and care into safety. Again, thank you very much.